Hi, Samantha Pech, registered psychologist. In this video, I'm going to be talking about what is bipolar and what causes it. So bipolar is a mood disorder that's characterized by mood swings. Mood swings that typically most people know of either being hypomania or mania, and then its opposite of being depression. And when somebody is in a hypomanic or manic state, they generally will start speaking faster. They have a rapid flow of thoughts that they may at times find it difficult to keep up with. There's an increased level of irritability, and sometimes that can play out where the person starts to actually feel irritable even with those around them because they don't seem to be able to keep up with what they're talking about or where their thoughts are going. There's generally a decreased need for sleep, so they might sleep 3 or 4 hours a night and actually feel rested rather than underslept or sleep deprived. And quite often there's an increased interest in sex and a lot of poor judgment. So an impulsivity might be driving faster, making risky decisions that they don't generally make when they're feeling well. And when people are starting to feel, with the manic and hypomanic states, more on the manic side, then they might even have begin to have like grandiose thoughts. So feeling like they're way more important than they normally are, or they might start to feel that they're famous. If they have religious beliefs, then these beliefs might become more intensified during these times. When they flip down into the other mood swing and go down into the low, then the kind of typical symptoms of depression will appear. So again, sleep disruption, might be needing more of it, having difficulty getting out of bed, feeling very worthless or hopeless that things will begin to improve. They might even begin to experience thoughts of suicidal ideation and generally having just low mood, sad, empty feeling, and difficulties concentrating on anything or making decisions. As for the causes for bipolar, um, there's a lot of there's some different thoughts out there, but the one that seems to grab the most attention is what's called the Diathesis stress model. And this model takes into account both the biological the biological factors as well as the environmental factors. So on the biological side, it's more about because bipolar tends to run more in families, and there's more likely you're going to be at risk for bipolar if you have a twin who has bipolar. Then there's a heritability aspect to it. And people ask, well, what is it that you actually inherit? And it's more about the neurotransmitter system. So there's an imbalance between the neurotransmitters in relation to the other neurotransmitters. And the other thought is that it might not be the imbalance, but it might be that the receptors on the cells that respond to the neurotransmitters are not working effectively. So with the environmental or the stress side of the causes, then this is more like you could be susceptible to bipolar, you might have the predisposition to it, or there's a family history for it, but then all of a sudden there's enough life stressors happening for you that all of a sudden bipolar symptoms begin to present themselves. And until that happens, you might always have this vulnerability for it, but it may not actually appear. So we're looking at sort of the combination of the two. And if you do have a family history of bipolar, then it's really actually important that you engage in a lot of self-care. You look at your level of stress, what you can do to make sure that you stay very healthy to reduce your risk of having the onset of bipolar happen. So in general, there's no real one final answer that everyone agrees on what causes bipolar, but there is agreement on the fact that it's probably a combination of biological factors and environmental stress factors.